I'm going to distribute these papers around. If somebody can just pass them around to each line and then go around like the very end, and they can pass it around. You know, each group like 10 in each line, maybe. Or 12, maybe. You should keep one for yourself, right? I'm hooked all over this place. So many wires. It's like somebody important here. I'm going to be talking while you guys can get this information. Can you hear me, everybody? Is this too loud or it's okay? Okay. Well, I forgot actually the topic of the lecture before I left the office, so I started guessing when I was coming here what I'm going to be talking about. Seriously, I did. And I believe the lecture is about the NutriFeron and the role of that in many diseases, okay? And whenever we want to talk about the immune system, it's always a popular lecture because the immune system, of course, is the most important system in our body. How many people were here in the last lecture when I gave an Optiflora? If you can raise your hand, okay? You were in the last lecture on Optiflora, digestive system, okay? The lecture actually continuation to the last lecture because the digestive system, as we talked in the I'm going to give you a summary of the last lecture for the people who are not here, that if anybody doesn't have any more, we have a few more right here, okay? Anybody doesn't have any, can raise your hand. Okay, everybody have some? You have some? Okay, don't read that because this is related to the lecture, but it's not the lecture itself, but it's related to something important we're going to be talking about tonight. How are we being affected and bombarded by viruses and chemicals and bacteria and cancer cells and all these things from outside and inside, and how can we fight back? And we can. So the last lecture, when I said we're going to talk about digestive system, everybody thought, you know, we're just going to be talking about indigestion or we're going to be talking about something simple, but it turned out to be a very scientific lecture, which basically what I said in that lecture, I have shown picture of the cells of the body in the digestive tract, and I showed you that if you take in your digestive system out, which I don't suggest you do that right now, and you spread it, it will cover 2 tennis courts, the digestive tract, 2 tennis courts. How much water would you like to drink to keep it wet? 2 tennis courts. You understand? Now you got the point about water. We're not going to cover it anymore. So the amount of water the digestive tract needs is between half to 2/3 of your body weight in ounces. So half to 2/3 of your body weight in ounces. We rather see men half and women 2/3 of their body weight. So the water issue was not a part of this lecture. It just came out when I said cover tennis court. So water is important. But the most important thing is that sheet in front of you, inside you, connecting you to the outside world, as being bombarded all the time by bacteria and fungus and molds and chemicals with the food, right? And however, we're not sick, or at least we don't get that sick. Our digestive system, when the baby is born, he is born if he was normal, and the mother have taken enough omega-3 and breastfed him and he delivered him properly, the baby have enough lactobacillus bifidobacillus and enough of the stuff and do well. And we went ahead in the lecture to say that the digestive tract is 70% of your immune system in the digestive system. 70% of your immune system in your digestive system. As a matter of fact, if you say, I got sinus allergy, most likely it's coming from the digestive system. If you say, I have lupus, most likely it's coming from the digestive system. If you say, I have rheumatoid arthritis, most likely it's coming from the digestive system. 70% of the digestive tissue is lymphoid tissue. Tissue that is specialized, fighting day and night from the mouth all the way to the rectum. Fighting every place and protecting you and producing antibodies against everything. Why did we have a bad digestive system? Why did we give the lecture last time? Is because people do not have good digestion, did not have good absorption, and they didn't have good elimination. So we said in the lecture that if we have the right amount of bacteria inside, like God wanted us to be in the days of Adam and even on our ancestor 200 years ago, we should never have any of the serious diseases we have these days. So if we make the digestive healthy, probably 90% of the problem will go away. Many of you probably didn't know that last time, and you probably, if you didn't hear me today, you didn't know that. The digestive system protects the immune system inside the body, because inside the digestive tract, that tennis court is covered with cells, and those cells is so impacted together, closed net, like you put your finger together like this, they will not allow any single bacteria to come through or anything to come through. And just in front of them, we have mucus, a little bit of mucus to keep it lubricated so the food doesn't get stuck. Otherwise, you go to the bathroom and everything be coming out. So, no, there is lubrication. In front of that lubrication, I'm just going to do a picture of that right now. In front of that lubrication, here's the digestive cells like this. There's mucus right here. In front of it are the bacteria that you get in Optiflora. And the number of bacteria you get in Optiflora, you're supposed to have in your digestive tract. Your digestive system have 10 trillion cells. But you have 100 trillion bacteria. That's a lot of bacteria. 10 bacteria for each cell. Out of those, 25 trillions are Bifidobacter or Optiflora bacteria. And they are different. They do not look like Escherichia coli, Klebsiella, Pseudomonas. They look different. They are large bacteria. They engulf Candida. They eat other bacteria. They eat cancer cells. They just love to be there to eat everybody else. They eat everything they don't think is correct. But they leave some to be around. But if one of them gets out of control, start causing bloating or gas or something like that, misbehaving, they eat it. If one of them, other bacteria, dare to come inside, they immediately attack it. And that's the topic of tonight, is the defense of the body against invasions from outside. We started by saying, by showing a picture right here. It says the miracle of the immune system. And that's what we're going to be talking about tonight. And in that, I gave you some articles with you, but before you look through it, let me give you some statistics. The statistics is from the year 1800 until the year 2005, the number of people dying from viral infections and bacterial infections are on the rise, especially hepatitis C. And also we heard about the bird flu. Just this lecture happened to be a good lecture for that right now. Because when we planned the lecture, we didn't hear about the bird flu. We don't care if there is a bird flu or a goose flu or swan flu, whatever flu comes in, we are ready for it. But the people who have weak immune system, they should worry about it. They should run and get vaccinated, and they should run to Washington, D.C. and get vaccinated. And the president said he got the vaccine for everybody, fine. Let him have it himself. Nutrition-oriented people do not need that. They do not need vaccination. They need good nutrition to fight for themselves. Because what vaccine does is buys a little of time. And many times people who get vaccinated get sicker after vaccine. How many of you got sick after you got vaccinated? See how many hands goes up right there. So vaccine is necessary in certain things like polio and when we had the epidemics and the measles and things like that, but it's overdone right now. But the number of people who are dying from viruses and bacteria and candida and having problem with infections are on the rise. Why is that? If we look at our life, our society, we'll find out there are 3 problems. Weakened our immune system. One problem weakened our immune system is poor nutrition, right or wrong. Second is stress. Third is toxicity, chemicals we exposed to. Is that true or not true? So this means if we did not have the proper nutrition, we're going to have poor immune system. If you have poor immune system, not only you're going to have viruses, but what else you're going to have? Allergies, cancer, autoimmune disease, lupus, inflammation, heart disease, Alzheimer, all of these related to inflammation, to immune problems. Nutrition itself is very simple. It's supposedly. You're supposed to have protein, carbohydrate, and fat, and vitamins, and water, and mineral, and fibers. But for 200 years, we've been eating the wrong proteins. Rather than eating vegetable proteins, we start eating lots of what? Animal proteins. And the animal protein we eat, we start adding hormones to it. We start adding chemicals to it. And the fish we eat, so full of mercury and dioxin and pesticides and so on, right or wrong? So we told the people, I've been lecturing for 30-something years, I've been saying the same thing. Eat soy protein, vegetable protein, lentils, beans, things like that. It's going to be a lot better for you. But if you're going to have meat, have chicken and fish and turkey, or if you're going to have beef, have the organic one. So that's one of the causes of poor immune system. The second, the carbohydrate. We had a lecture given here in this room on syndrome X, and we talked about too much white flour, too much sugar, too much juices, causes too much liver disease, causes too much secretion of LDL, VLDL, high triglyceride, and growth hormone that causes cancer. So carbohydrate should be consumed in the form of fruits or whole grains. I'm summarizing for the new people today what we have said before, so you didn't get lost in such lecture tonight. We're still going to continue with the lecture. The fat, also, we've been consuming the wrong fat for years. Rather than consuming the olive oils and all the good stuff, we start consuming the wrong oils. So we have more problem with our immune system. So the solution to that, to go back to the good oils, beside, don't forget about omega-3. Vitamins, we talked about that also. Tonight's lecture is not about vitamins. It's about other things, about NutriFeron. But let's cover it for a second here. We know that our soil does not have the minerals, trace minerals, for the plants to make good vitamins for us. For example, is vitamin B complex or B12 good for us? Right? It's good for the immune system. And in the soil, if we don't have enough trace mineral like cobalt and cyanide, we're not going to have cyanocobalamin, which is vitamin what? B12. So which farmer, I'm a farmer too, which farmer going to take some cyanide and put it in the soil? You can touch it, but how can you get it back in the soil? Organic fertilization. We don't have it. So what will happen? We have chemical fertilization, and the vegetable looks good, everything looks nice, and we think we're getting good nutrition. We're not. We get colorful food that's been sprayed to look good or been painted to look good, but the quality of it inside is not there. Some of you have gardens in your home, and you grow your own tomato. Your own tomato at home tastes much better than the one you get from the store, right or wrong? Right. Because you organically fertilize it. You have a good product, you know. So vitamins must be added to the diet to improve the immune system. Water also. For years, we've been told not to drink water, to drink Coke and Pepsi and beer, but not water. You know that. You know, you have seen ads on TV of the guy walking in the desert very thirsty, and somebody give him a glass of cold water, and he said, no, I don't want that. I want beer. Straw beer was that time. Anybody remember that ad? Okay. So what is the child who is 10 years old, your grandson or your son, sitting next to you going to get the point? He's going to say, if I'm thirsty, I'm going to drink beer. But water is very, very important to drink good quality water. We were not drinking good quality water. In the Olympic Games, always in the Olympic Games, a guy would be swimming in the pool, coming in the other side, holding a bottle of Coke and drink it, because he's so thirsty. Well, if you're so thirsty, why didn't you drink the water you're swimming in? No, because any water with sugar in it is going to taste better than water without sugar. This is the sugar makes people drink the water, right or wrong? But actually, water itself, it tastes good, cold or hot. We drink it as soup, we drink it as regular water, we drink it cold. So we needed to add extra water. This is supposed to be the end of the lecture. I'm put it in the front before I forget, because every time I do, I forget and I don't put it. So I put it in the front today. The minerals also. Zinc, manganese, magnesium, all these trace minerals are important, and they're not in the food we eat. Because if they're not in the food we eat, it's going to affect the immune system. And then the last one is fibers. Having enough fibers in the diet will make the digestive system what? Better, right? If it is better, it has better circulation. If it is better circulation, it doesn't have many germs, and then you have better immune system. Stress also affects the immune system. And then I just came from where I was taking my board in American Board of Holistic Medicine last week, and we were actually, I was one of the lucky 57 physicians from around the country who's specialized in preventive medicine to be there in Austin, Texas. And we had classes between us, all professors, to teach us what everybody knows about holistic medicine. And I'm sitting learning from other colleagues, what have they done. And I'm shaking my head. I can't believe there is somebody else beside me in this country who does nutrition. I was so happy, so proud that I was just like in heaven. that we all look at each other. Who are you? Well, he said, I'm a professor of so-and-so in Harvard. And this in John Hopkins, and they practice they're coming for holistic medicine. We had 57 physicians and 100 residents and fellows. I had a girl next to me, and I said, what do you do? She said, I'm third-year family practice resident in Minnesota. I said, what are you doing here? This $3,000 tuition, and you're sitting with us? Are you going to practice holistic medicine? Of course I will. So there is lots of people getting in the field, and that's make me very proud. One of the things we talked about that was very impressive, of course we had 6 days from 8 in the morning to 10 o'clock at night classes, with 5 minutes breaks, 1 hour for lunch, 1 hour for dinner. And the exam on Friday was 5 hours, 338 questions, which was extremely difficult. Whoever put the exam, I told Dr. Anderson, he's 84, he put the exam. In the end, I told him, what are you doing? You try not to have any of us pass or what? But anyway, he's the founder of the association, and the association was done officially, recognized by the government to challenge the American Medical Association. And this is the association, American Board of Holistic Medicine. You will hear about it 2 years from now. It will be the group of doctors that the Congress will use to monitor nutrition all over the country. It's going to be, we were told that by people from the Congress. They came and they said, once you are a practice, you have your certification, we will use you to check on these companies around the country to see which one is legitimate, which one is not. So the one, we're telling the FDA, rather than you doing it, we can do it for you. We can tell you which company is good, which company is bad, without any bias. We will take a product, put it in spectrometers, we tell exactly how much in it, and we tell the government that company is legitimate, this company. Because 99% of the companies in the market are not legitimate. 99%. Shaklee #1 in the world. Maybe the other couple companies underneath that they're good, and the rest of them are lying all the time. You buy their product, and there is absolutely nothing in it. And there's nothing I can do about it. They get away with everything. So we talked about, one professor told us about stress and immune system. 4 hours talking about stress and immune system, I'm listening. And all the 6 days were scientific paper presented every 10 seconds. So every 10 seconds there was a paper published in front of us, scientific paper. So there was nothing non-scientific. When it came to spiritual part and stress, and I want to see what's published about God, I said, this is something I talked about it in the past, but I didn't know somebody published something about it. It was. Actually, they had group of students, medical students, or atheists, and a group of students who worship somebody. Some worshipped God in the form of Jesus. Some worship God like the Jews in another form. And some worship as Allah in the form of Muslims. And some worship God in the form of Buddhists, okay? And each one was told, the group who are worshiping, you must concentrate on whoever you believe in. You must concentrate. Then they connected electrodes in the blood, and they start measuring the brain waves and also how much NutriFeron coming out. And the other group said, you believe whatever you believe in. If you don't believe in anything, that's fine. Just do what you have to. And they exposed both of them to stressful pictures in front of them. Movies, very horrible things and pleasant things. They were measuring the people who have faith in something. They all had 30% more interferon, and the people who did not have faith did not have any. So imagine that. Had nothing, and this is something was even published, so, and also, married also did better than singles. And also, men or women, both, married did better than singles, and people who have a close family net, did better than the people who do not have a family, who are just loose. The close family, the father, the mother, the grandmother, all together, they did much better than the one who running around loose all over the country. So they all just get out of here and go to California. Okay, so everybody want to go to the beach or Hollywood. So stress, poor stress, we have lots of stress at home. We have lots of stress at work. We have lots of stress in the street. So we can minimize stress by prayers, by exercise, by good night's sleep, by laughter. Actually, we have a lecture on laughing. We had lecture about even touches, even hugs. There was lecture about that. Everything from love to hugs to spiritual to touches, everything they studied it, how important those things are to human health. This is why it's holistic medicine. Means the body as a whole. So not only I'm going to be talking nutrition, now I have to go to UCLA now to take 2 years to learn acupuncture. I got to go learn about other things. They show us how chiropractic works, and I have no interest in that, but we had to pass it also. So anyway, I'm not interested to be a chiropractor because I'm from Cairo and practice medicine anyway. So, so I said, well, I'm a born chiropractor. So anyway, the last one is toxicity. The last 200 years, we are bombarded with chemicals. Is that true or not true? Am I making it up or you know about it? Every day, our water, air, everything is being polluted. And that will affect the immune system. Now, that immune system, when the immune system goes down, what will happen to us? We cannot fight. What do we fight? We fight outside germs and inside cancer cells. So if we look at the human body is built from organs. Okay, this is an organ right here called the bone. That function of that bone is to make immune cells and red blood cells. White blood cells and red blood cells, right? Okay, that's the immune cells. If that bone is not getting the nutrition it wants, it cannot fight back. If it's getting too many chemicals, what will happen to the cells? You're probably getting lost already. Let me just slow down here. The cells right here of the bone, they make antibodies. You heard about antibodies, right? The antibodies are the things that go out and seek anything doesn't belong to you and kill it. So our friends are what? The antibodies, right? So the immune problem is lack of the proper antibodies. Each antibody coming out have the same number of the mother cell. The mother cell here have a social security number, right here. Every one of us had number. Every antibody have the same number. When they travel through the body, they go through my veins right in arm right here, in the hands right here, they ask every cell, what's your code? If it's the same code, they'll go on next one. If it's different code, they come and eat it. And that is how the immune system works. They work because the human body needs to be protected. Remember, the bone marrow can have no defense. It produces antibody, but it has no defense itself. So if you get infection in your mouth or your sinus or your skin and it goes to the bone, you have a problem called osteomyelitis. What's the treatment for it? You cut the leg off because the bone cannot fight. But with nutrition and antibiotics and things like that, we'll be able to save lots of bones. But some of them, when somebody has a frostbite and they can do something, what do? They cut it off. When somebody have an accident and the leg is infected, gangrene, what do? They amputate it, right? Before it spreads through the whole body. So who protect the bones? The antibodies that the bone is making. Inside this person in front of us, there are organs. One organ here some people don't have, also made of cells. This organ called the brain. Have you heard about meningitis, encephalitis, West Nile virus, bird flu? Where do they go? They go to the brain. What do they do in the brain? Kill it. So, is that important to have a good immune system to protect the brain or not? Let me tell you a small story. Really, it's very important for you to hear it, because if you're a doctor here or you know a doctor, you should convey that. One time I was working in a hospital, Highland Park Hospital in Highland Park, Illinois, and I was second-year resident, and I have first-year resident with me. We were passing the emergency room to make rounds, see what's going on before we go to bed in the hospital. We saw a man and a woman have diarrhea because they ate Baskin Robbins in Michigan, and they both have diarrhea. And it was like 10 o'clock at night, 11 o'clock. So I told the ER doc, I said, why don't you admit him and we take care of him? We take care of them in the hospital because we are resident in the hospital, not on the ER. He said, no, we send them home. They just have a flu or something. In medicine, there are two ways to approach patient. Wait until they get sick or do something before they get sick. Either prevention or wait until they have problem. They send them home. 1 o'clock in the morning, I get a call from the nurse. He said, we have somebody with 104 fever, and he doesn't sound very good. He looks semi-conscious. So then I ran to there. I woke up the first-year resident with me. I told him, you come with me. And we both ran over there to check on him, and he looks a little bit delirious. It was the same man I saw in the emergency room 3 hours before. Same man. His wife was in there. I said, what happened? He doesn't talk. He doesn't remember. He doesn't know who I am. I told the nurse, I think we have a problem with meningitis, infection in the brain. Give me the needle. I put the needle in the spine. I got the fluid out. I went down to the lab, in the basement, turned the lights on. Nobody's there, and got in the lab. We got the microscope. Look, for 1 hour looking under microscope, can't find nothing. Until just the last second, I find one bacteria by itself, glowing under the field, and looks dangerous. It's a kind of bacteria. It has two attached together that we do not like to see them in medicine. It was Diplococcus. They called the other guy, doctor, come here, look at this. This looks like Diplococcus. We've seen it in the book. We've never seen it in patients because people usually die from it right away. And he said, oh yeah, it is. So I told him, notify the health department, notify the floor, notify the nurses, notify everybody, quarantine, everything. We notified everybody, and I gave the guy injection of 6 million units of penicillin into IV push, which is a high dose, but that's the only thing I have no idea he's allergic to it or not. We have time limits to do, but we can actually protect a patient from dying from penicillin. Is very easy, because if you mix a little bit of steroid with it, they don't have a reaction anyway. So I mixed some steroid and injected. Within a half an hour, he's awake, alert. In the morning, I make rounds, and he's back again, going back in a coma again. Then I said, okay, let's do a CAT scan, let's do this, let's do that. We did a CAT scan. Every scan in the world we did. CAT scan, dog scan, rat scan, every scan we did. But there is nothing we can see. Blood test looks good. Everything looks good, but the guy's dying. See how limited we are, how great God is, and how limited we are? If we know these miracles, we know how little we are. But we're too arrogant. So I gave him 17 million units of penicillin IV push. 17 million units, too high. Can cause a little bit reaction also. he wake up within half an hour. By the evening, he went back in a coma. This time, we give him 60 million units. I haven't gone home yet. I still be working 24 hours with him. 36 hours, I still be working with the guy. I haven't got home yet. So, neither of my residents also, he refused to go home also. He stayed with me. Then, 60 million units, of course, will cause lupus, which we knew that, but he's going to die, so we had to give it to him. And he wake up. A day later, he went back in a coma and died. Now, oh yeah, we did spinal taps, mini-spinal taps, they're all clear. So we did autopsy to see what's going on. The whole brain, the whole body was free of infection except the brain was covered with slime, bacteria, pus. We couldn't see it in the CAT scan. See, we thought it's a brain tissue. It looks like a brain tissue because it just looks like a brain tissue. So whenever an infection goes to the brain, it can be serious. That's why we worry about bird flu and swine, all these flus you worry about the brain. And you hear some people die from West Nile virus, and that's why they die in the brain, affect the brain. Immune system also protected that. We have the lung. If you have infection in the lung, pneumonia can kill you, right or wrong. Also made of cells. Kidneys infection can also kill you. Intestine infection can also kill you. All of these organs do not have any defense. They have to defend it by what? By the antibodies that we had it a few minutes ago right here. I don't know what happened to it. But anyway, you remember what I said anyway. Yeah, we had a cell right here. What's that? Oh, okay. Right here it is. Okay. So we be defended by antibodies. And even the heart, which is right here, by the way, we discovered also in this course we were taking American Board of Holistic Medicine that the heart is part of the brain. We didn't know that. That the heart has as much nerves in it as the brain does. And the heart, we think the heart and the brain is connected with each other. This is all new information. We don't know how it happened, but we know that the heart, the brain sends the nerve to the heart to make it work, and that's the only organs that does that. The heart made of cells. If the heart gets infected, also we're in trouble, right? We have endocarditis. The arteries, if we get, or the veins get infected, we have problems. So this system right here is defended by antibodies like that. And I like to show you how the immune system really works, because this is related to the NutriFeron, how it works. When a bacteria comes in, it looks like this. It has two mustaches like that. It has several legs. And enter through your sinus, or through your throat, or through your skin, or through your bowels. And the first thing, when it enters, right away in the bloodstream, we have a cell right here called the white blood cell. That cell is migrating, traveling in every tissue in your body. In the lymphatic tissue, under the skin, every place there is a cell, not one. We have actually 7,000 of them for every drop of blood. A drop of fluid, any fluid, even the stuff you sneeze out. For every drop, there's lots of them. When they see somebody like this, they ask them for their social security number. It's different code. Then they have binocular like this, and they hold it like that in their hand, and they're looking, magnify the guy, and then they said, doesn't look right to us. We're going to do something about him. In the meantime, the white blood cell has a little telephone with it. And right away, it calls the rest of the body. Let me bring this person back here. And it starts calling the lymphatic tissue that around the guts here, or around the throat. There's lots of lymph glands all over the place. They call them, and they tell them, we see somebody looks like have 10 legs and mustache and this and that, and we want you to be ready because it could be dangerous. Then this cell will have hands, long hands, start sticking their hands out like this, and they start feeling the body, massaging the bacteria body. What they're doing, they're collecting information about the DNA and the type of bacteria it is. They're not killing anybody yet. And they're storing the information and send it by computer to the lymphatic tissue, which waiting right here. They give him the information. Then they grab it and they eat it. And then once they eat it, then it's finished. And every second you're sitting this right now, those 100 trillion bacteria in your bowels, approximately 1 million of them entering your blood every second. Right now. But we have no idea they're being killed. Your skin full of bacteria and mites and parasites and candida, right? We have lots of things in our skin. But all of us, we don't look like we have pus coming out of our faces. What's happening? Because we have protection. We have immune system that protect us. This immune system, if it fails, we have a problem. The way if we have an attack, if we've been attacked by a virus, like the hepatitis C, which looks like this, or bird flu, which looks like this, or candida, which looks like this. If we get attacked by any of those, we have the ability to what? To identify them and what? And destroy them. If they ever succeed to kill the first line of defense, then the second line of defense right here. Because when you magnify that bacteria or that virus, you will find out that virus or bacteria, if this is the bacteria, has holes in its body like this. One hole is round, one hole is like this, and one hole is square. And this white blood cells will measure the dimension of it in millimicron and the description and give it to this. By the time the bacteria passes through or the virus and come right here, if it succeeded, this guys right here will release nails, look like this, and looks like this, and looks like this. And they stick them inside the body of the bacteria right here. They stick it, they start bombard it in, and I have a picture actually. I was sitting here trying to find which picture to show you. We have live picture of bacteria being attacked and viruses. I might find you one to show it to you. It's very, very really amusing. It's very nice to see. I just went to Office Max. I spent 1 hour there, and the guy was confused. So I got the pictures with me. Whatever I can, I show you some. But they will do that, and then when it passes to the third line of defense, which is the spleen, that spleen releases. The spleen looks like a guy, looks like this. We have to draw another person here. Okay, this is the person we have right there. And the spleen is right here in the middle. When this passes by the blood passes by the spleen cells, they look like that. And the bacteria is coming right here full of nails. This spleen have guys sitting on the wall, looks like this, each one holding a hammer in their hand. They bang on each cell. They keep banging. This is called complement fixation system, or how the body gets rid of bad things. Even your own cells, when they get old, that's how, if a cancer cell, that's how the body gets rid of them. Identify them, pass them through an area, attack it, blow it up. And then, actually, I might have some pictures right here to show you of that, because, okay, this is, I don't know if you can see that or not, but this is, maybe you can. Okay, let me see. I'm going to be sophisticated and use one of those pointers. I have never used one before. Oh, yeah, it works. That's good. Never used one before. I found it in my bag. It's been there for 10 years. Okay, this is the skin right here. And then the bacteria right here in the skin in this area, living in the skin right there. And you can see that none of them can go through this layer right there. But that's not the one I want to show you anyway. The one I want to show you is right here. Right here. The first step right here, the white blood cell identified the virus or bacteria, you see there? And then the first step, they extend their hands and analyze it. So you thought that was a joke? That's a real picture right there. Okay. Step number 2. The bacteria are captured and trapped within the extension right here, right there. Step number 3. The bacteria which trapped get blown up. So that is real pictures from real person. But I had another one in a different bacteria. This is a white blood cell right here. Bacterias in different angle, they try to attack right there. These hands right here are the NutriFeron, by the way. That's what NutriFeron does. Interferon, NutriFeron, and gamma globulin, all of these are the hands that allow them to destroy right there. But I do have a real nice big picture right here. This is magnified picture of the cell, and that's a bacteria right there. Oh, I have to turn it over like this so you can read it. How do you use this? Okay. And then you see the hand right there, and we have here the macrophage A trying to reach out to bacteria, number C right there, and entrap it with the extension called pseudopod right there that's coming out, which part is the NutriFeron, also interferon. So you understood now how we fight the same mechanism. We are fighting this. We can fight what? We can fight cancer. I think I have a picture about cancer cell someplace, but yeah, here it is. Actually, so I'm a lucky. This is a lucky shot because I have 100 right here. Okay, here is a cancer cell. Okay, this is a cancer cell right there. And the killer, the T cell rounded shape right here, this is the killer cells. Because the cancer cell is bigger and growing faster, not like bacteria, so it's huge like this. So you have many killer cells around the cancer cell. And here, the T cell, they attack the killer cell which have surrounded the cancer cell in the right here. This is a cancer cell right there, and this is surrounded, try to kill it. So by seeing things with your eyes, and it is in the DVD tape right there, then you can identify it. And I have no idea what that is, but I have to guess. It's from a book a friend of mine wrote, by the way. I took his book, and I had a permission to make copies from. Okay, this is actually a cell, our good cell. This is not a cancer cell, but it's taking chemicals. All of these are poison chemicals. They suck in to get rid of it. So the human body not only get rid of bacteria and viruses, also get rid of cancer cells and get rid of also poison that we form all the time. This is really just a summary. I'm going to put it here just because I want it to be on the DVD so you can buy one. So, so that make you buy one. So this is like a summary of the immune system right here. And it starts with, we're not going to go through the whole thing, with one right here, which is the white blood cell eating the bacteria, and number 2 goes in stages like that until it produces NutriFeron and interferon, all of this, you see it right there. We don't have any time to go through all of that, so I'm just going to skip through it. we don't want to get too scientific, but I want to just talk about a little bit about this here. This cell's right here called the helper cell. Actually, this is the cell that's eating the stuff right there. That cell called the helper cell. The helper cell is the cell coming from the lymph node. I told you the lymph node, that's called the helper cell. It comes out to help because it has computer, it has information, and knows where to put the nails and how to stick. You can see right now is attempting to fill the hole right there, and that's how the body fights those things. This is really a nice picture also to show you that those balls and nails and all these things, right, how they look like right there. This is a bacteria right there. Okay, it has attack antigen. And this is the body releases those things right here against the bacteria to fill the hole and go around it, as you can see right here, before it blows it up in this down here. So the idea, what I was talking about, to try to make it simple, actually is immunology. That's how the body works. Now, I wanted you to look at the article I gave you in your hand. And I'm going to put it in the screen. But you don't have to read it because I'm going to read it fast for you, okay? That's lots of papers. But I gave it to you to keep at home to give you an idea why we are tired, what bacteria we get attacked, what virus, what can we do about it. This paper, I wrote it and approved by the National Institute of Health and actually distributed to physicians around the country by the National Institute of Health to understand chronic fatigue syndrome. Now, you don't have to read it, but I'm going to make it simple so you can read it. It says right here that chronic fatigue syndrome is an illness characterized by debilitating fatigue. You feel like flu and high fever. Sometimes you get headache, difficulty concentration, exercise intolerance, lots of symptoms you go to the doctor for. Unlike short-time fatigue and that you get after you go to the gym, this lasts more than 6 months. So if you have fatigue lasted more than 6 months, you have the same energy you had 20 years ago, something might be wrong in your immune system. Okay, now we go to the well, I don't know where it is. Okay, I think this might be number 2. You can correct me if I'm wrong. I think this is number 2 page, right or wrong? Yeah. Okay, number 2 page, because I had it mixed up right here, so you're going to have to help me out to get to it. When we were sick in the 1800s, we used to call the people who get tired, they have fever of like Dracula or something magic or some ghost or something like that. Well, by 1850 we got a little bit better. We named it something else. By 1900 we named it something else. But the last one right here, 1950, we start call it Candida, and right now we call it chronic fatigue. Chronic fatigue is not really a problem with just infection. It can be from cancer, it can be from hormonal, it can be from heart, it can be from toxicity. And we go to the next page, which maybe this is the next one, right? Or it is? Okay. It says right here, the hallmark of the chronic fatigue is the onset of illness, typically flu-like symptom. In contrast, like flu illnesses, this is last long time. Now, I'm going to go right here. It has headaches, aches, and pains. And we're just going to have to skip that. That's not the page I want. Okay, this is the page I want right here. This is the right one? Because we want to talk about immunity here. Well, I want to show you what the immune part of the article is. You got that right here, the immunological factor. in your paper in front and with your hand. Many different immunological findings have been described in patients with chronic fatigue syndrome. No single immunological disturbance has yet been identified as atypical. However, we have disturbance in the people who are tired, include depressed natural killer cells. You see right there, natural NK cell. Means those cells they kill, they are depressed in the people who have poor nutrition. Means when you have infection, you can fight it. Your immune system is depressed. Those cells they eat, yours is drunk. They can work. They're going to sleep. They see the bacteria, said, go, take care, you make yourself at home. And that is what most of us are. Our immune system is overburdened by fighting pollution, nutrition problem, stress problem, this, and the kids, and the job, and the money, and immune system is overburdened. This is why it forgets there is something going on. And some of you, every one of you, you must have had an infection one day and bothered you. Either sore throat or ache or sinus. And you know how miserable you can be, right? Infection can be very serious. And right here, we find that those people who have fatigue, tiredness, they have depressed killer cells, but they have elevated viral antibodies. Meaning we find viruses in them. Lots of, when we take a blood from somebody, we find lots of viruses. And which kind, we're going to look at the next page. We find also they have immune complexes. Means they have antibodies against their own body. They make in like lupus type, like they make an antibody that goes around, attack its own body, like Crohn's disease, ulcerative colitis, migraine, all of that, psoriasis, all of that. You're attacking yourself, and that is not good. Now, we go to this page right here, and the most important part of this page are those viruses right here, because that's what we're going to talk about, NutriFeron, after that. These viruses that we have discovered are the herpes family, Epstein-Barr virus, cytomegalovirus, herpes 1, herpes 2, herpes 6, enterovirus, Coxsackie, and echovirus. And hepatitis C is one of those families behind that we're talking about. You can take that home and read it on your own time. We're not going to read it now. Then we're going to skip the next page, and I want to go to this one right here. This is a summary. The next 2 pages is a summary of the whole article. This is, if you want to learn something, keep those 2 pages in your mind. That if somebody's tired, you must ask a question. Is he making it up or he's really tired? That's the first question. Is the person really tired or just lazy? You follow me or no? So that, number 2, you must be sure that patient does not have malignancy, autoimmune, localized infections, Lyme disease, TB, funguses, all kind of things, HIV, psychiatric problem, schizophrenic, doesn't have autoimmune diseases, hepatitis, all of these things, or hormonal imbalance. If the person doesn't have these diseases, none, but still tired, then we go to the next page, and that we make our diagnosis. If the person have no cancer, no lupus, none of that, but they have fatigue, then we ask a question. If the person have, to fulfill the minor criteria, symptom, the person must have some of these right here. Maybe fever, sore throat, painful lymph node, weakness, muscle ache, prolonged generalized fatigue after exercise, like you go to the gym, exercise, but you're still tired 3 hours later, headaches, any kind, aches and pains in the joint that travels around, light sensitivity, forgetfulness, excess irritability, confusion, difficulty thinking, inability to concentrate, depression. I guess this applies to all of us. Sleep disturbance, hypersomnia, all of these things right here. If that is the case, then we're dealing with chronic fatigue syndrome, means there is some kind of virus inside the body, and we must improve the immune system. To improve the immune system, we came out with the idea that we talked about in the beginning of the lecture. We said, if we have the proper protein, the chocolate soy protein, I'll tell you how I take my protein. Maybe I give you some examples on myself. How do I live? Okay? In the protein, I take mine in the morning, at night. In the morning when I wake up, I get a glass of water, I get 2 scoops of those proteins and put it in it and dissolve it. If I want something sweet, usually don't. I add a little bit of honey to it to make it a little bit sweet, and I use soy complex, not energizing soy protein. If you're underweight, use energized soy protein. If you're overweight, use the soy complex. That's better for you. Soy protein is a wonderful, wonderful product. It does so many things good inside the body, and I have written a note about it when I was coming, and if I can read my handwriting, then I will show it to you. Okay, let me find it. If I can find it, I will give it to you. Yeah, I found one right here. No, this is. Yeah, but why not? We can use that page. I think there's another page better than that. Yeah, this is what we're going to use. That soy protein, they block mutation. They prevent the body from developing cancer. And the idea that soy causes cancer is a false idea. Soy protein do not cause cancer of the breast. We have 3 billion people live in Asia, India, and that part of the world consumes soy for thousands of years. And they have the lowest incidence of cancer of the breast. My patients who have cancer all have soy. I never seen a recurrence. Of course, most of them take chocolate products also. So they're healthy to start with. So maybe that's a factor. It also inhibits the enzyme tyrosine kinase. I'm adding this to the DVD for a reason, because some people making propaganda about soy protein that if you have cancer, don't take it. And I want to counter that by giving you a scientific study against that idea. The idea they said the soy protein causes cancer of the breast came when they had Petri dish with cancer cell in it, and they put soy protein, wrong kind with the wrong stuff in it, and they saw cancer cell multiply twice. That's one study. There is 5,000 studies to prove soy protein works against cancer. So they take one study, which is mistake, make a big thing about it, and leave the 5,000 studies that proven that's wrong. You've seen it in vitamin E study. You've seen it about beta carotene. We're always going to be attacked anyway. Since when we're going to win? One of the doctors told us when we lecturing us, one of the professors from New Mexico, he said, you know what? You're dealing with $2 trillion industry. United States budget is $3 trillion. $2 trillion of those in health and sickness. You think they allow us, we're 57, to hurt their $2 trillion? Because to make money, we must have disease. We must have hospitals. We must have drugs. We must be sick. It's sickening to think that way. But money is evil, and you can see it in gasoline right now. It's evil. They're making billions and they don't care. They even told the Congress, say what you want. We own your government. We own the country. What do you think you can do? Anybody can talk. Anybody. From the president down, they can remove him just in 1 second. They own the newspaper, the TV, this. And they're going to say, this guy Bush, he did this and this and this. We get mad. We get rid of him. This guy Clinton, he did this and this and this. We get rid of him. That's how they work. But you know, if we have faith in God, and remember the Boston Tea Party, we always can throw the tea in the water if we want to. Because remember that. So liberty with this country, with the people, and nobody can take it from us. They can do what they want, eventually they fail, because God is on our side, and our heart is on our side. Okay, we also found that protein inhibits cancer from making its own protein to multiply. It inhibits the cancer cell from getting blood, inhibits angiogenesis. I mean, the blood needs a blood supply, they shut it down on cancer cells. It changes cancer cell to normal cell. I even can read my own handwriting now. Increases apoptosis. Apoptosis means they make the cancer cell self-programmed to blow itself up. And we don't have time to talk about how this happened, but that is one of them. You know that soy protein helps chemotherapy. I have patients on chemotherapy when they take Shaklee vitamin and NutriFeron and protein. Their doctor tell them, what are you doing? You're doing so well. You're the only patient I have who's doing well. Is because they have nutrition. And it decreases prostate size and does lots of things. It helps postmenopausal, and also it helps bone formation, inhibits LDL, inhibits cholesterol, and does lots of things. So the protein is very important to eat the proper protein. I do drink 2 tablespoons, 2 scoops in the morning and 2 scoops at night. It's very good at night for digestive system, by the way. If you take 2 scoops of it at night, the soy complex, drink it before you go to bed with a piece of fruit with it, you will not have heartburn. Because protein is powerful what? Anti-acid. It's the best anti-acid. Salad also the second best anti-acid. Vegetables. Carbohydrate, we must eat more fruits. Fat, we must eat the good fat we talked about. We must eat lots of vitamins, drink good water, take minerals, take fibers, control the stress, and detoxify. In our patient, what we do, we remove the lead and mercury from their body if they have it by chelation. Also in our body, in our practice, we give them other substance to boost their immune system, such as immune globulins. Okay, I'm going to go back to, we're already done with this article, but I want to show you something else important. That is, okay, I think I'm just going to talk without seeing it. Okay, we're going to talk right now about NutriFeron. Okay, this is a scientific study done on Shaklee NutriFeron, and what happened here is the Japanese scientists decided to try to find a way to build the immune system. So what they have done, first they study what is the problem. They find there's lots of malaise and fatigue was observed in many patients. So they have manufactured the substance, which I don't know if I have it with me right this second, or I cannot find it. If I find it, I'll show it to you. I will show it to you later on. They succeeded of putting together 4 different plants together to make a substance, and they name that substance, they give it a EH0202. They studied 200 herbs from China, find out which herb have the most potent to make the killer cells more potent killer, and they find out that 4 different herbs did that. The same scientist, Japanese scientist, who discovered interferon, when the interferon was kidnapped and hijacked by American company to make it synthetic, he decided he doesn't want to be involved with them. So he decided to find something in nature that does it rather than use the interferon, because interferon have lots of side effects. And ribavirin has side effects. So the company was using the stuff. It does help hepatitis C, but my mother died from hepatitis C. And my brother died now also dying from hepatitis C. And I sent him lots of NutriFeron about 4 or 5 months ago. And he's supposed to be dead 5 months ago, but he's still alive. So because he's still alive, I'm going to go next week and see him. And I'm taking with me another 30, 40 bottles of NutriFeron and vitamins for him. Half of my bag will be vitamins when I'm going to go on Tuesday. Because he's still alive. He haven't died yet, but he have hepatitis C. This study right here shows that in 6 patients, they were tired before they give him NutriFeron. 1 month after administration, improvement was observed in 4 of the 6. 66% of the patient not tired anymore after 1 month taking NutriFeron. Improvement was also observed the same in 4 other patients after 3 months of administration. The same patients still not tired 3 months later. 2 patients had bloating and sensation in the abdomen, and they were improved. 50% got improved. 1 patient, the 2 patient was improved. Patient had nausea and vomiting, also was improved. So this study here shows that in fatigue, 6 patients started, and they were improved in 4 of them in 3 months. Bloating, 2 out of 2 got improved. Nausea improved, and itching did not get improved. But the white blood count didn't change. The hemoglobin didn't change. Platelet didn't change. This means that this substance right here that Shackley made right there, it has to be working in the interferon production and the killer cell, not in the red blood cells. So it worked in the immune system. This here is a curve to show that I don't think you're going to understand most of it, but let me assume that you will. When we count how many viruses somebody have in the blood, we count how many particles of virus in a drop of blood. How many? And we look at so in my case and my brother's case, he had 3 million pieces of virus in 1 drop of blood. I have another brother have a hepatitis C also, but he is in Shackley vitamins, and his number went from 3 million down to 100,000. Okay, but the other brother, I don't know his numbers yet, because I'm going to go next week to find out what happened. We're going to do a blood test. But the number here, this person has 1.5 million, in 1 month down to 1 million. That's a decrease of significant amount of virus came down right here. So the study here shows scientifically that NutriFeron, that hepatitis C virus RNA decreased significantly after 3 months of administration in patients with 500 to 849,000 in general. And 1 patient who had a level of 1.4 million came down significantly to normal level. It went to below detection, means they cannot find it in the blood after 1 month, using the EH0202, which is the patent number for NutriFeron. Okay, this is the last discussion, and this is written by the Japanese scientist. I got this from the Shackley Convention when I went to the scientific convention there. They give every one of us the paper so we can read it, so we can believe in it, so we can use it in our practice. The discussion, he says, United States currently have 4 million people with hepatitis C virus. Hepatitis C is a major international crisis. The general strategy right now to give them, to give these people interferon, and that have lots of side effects. And we combine it now with ribavirin, also have lots of side effects. However, complete response has not yet been seen. We haven't seen cure yet, like we've seen with the NutriFeron did. This treatment also associated with lots of side effects. So I know my brothers how much side effects they had. In one study, the amount of virus in patients with high viral load, over 850,000 in Shaklee, that's the kind we're talking about right here, EH02, decreased 65.7%. It has been shown in animal study that EH0202, which is NutriFeron, promotes phagocytic activity of macrophage. Means it makes him eat germs easy. That's how it works, right here, in the blood. It has also been reported that EH02, which is the NutriFeron, promote phagocytic activity of peritoneal macrophage and promotes interferon production. Means here in plain English now, I translated to you from that, means in the guts, the bowel, it helps the bowel to produce the right antibodies. You know, that's what it says. Peritoneal means bowels right here. And also, there is also another benefits from it we have seen. The use EH02 either works by itself or works with other chemotherapy. We can use it with any other therapy. It doesn't hurt anybody. Even use it against cancer, it doesn't hurt anybody. And as a matter of fact, you have to understand that also can work against cancer. Because cancer many times produced by a virus. And it says right here, it can prevent development of carcinogenic process, lead to hepatoma. It appeared to suppress the viral titer. With respect to the clinical symptom, even got better. The finding also suggests that EH2 may also contribute improvement quality of life of the individual who has taken it. And there is many other things we can talk about. We don't have the time to discuss everything right now. I'm going to this is another factor I want to discuss with you, that not only we can use nutrition and NutriFeron also to counter cancer and counter viruses, we can use also something called immune globulins. Well, that's what we do in our office also, because the immune globulin itself, the Y shape, when we take it, it facilitates destruction of cancer cells and viral cells inside the body. The last thing I want to talk about is the poor alfalfa right here. Because every time I want to talk about it, I forget. Yeah, that's the last thing I'm going to be talking about tonight. Yeah, here is the first page from the NutriFeron, that the one I couldn't find right here, to show you how the NutriFeron study was done. It's a mixture of herbal extract, was known to stimulate macrophage activity. Dr. Ishoko right here, who has first described interferon 1970, he then took it on himself to make it natural. He got 200 herbs from Chinese medicine, and he extracted it from pumpkin seeds, special kind, plantain seed, Japanese honeysuckle, and safflower, and he named it EH0202. So you know that this product is wonderful product, and it is very, very helpful to, especially the flu season coming. And if you take one twice a day, it's plenty. Some people have been taking 6 a day, 8 a day. You can take as many as you want to. If I have cancer, I take more, but it depends, because you just follow what the company says is really better. Alfalfa also does help the immune system. This is the most forgotten supplement that Shaklee have that people people underestimate it. You have to understand that the largest animals in the world surviving in this earth, they eat, the strongest one, they eat alfalfa. I raise horses. I have 25 Egyptian Arabians in my farm. I raise them. What do I feed them? I don't give them McDonald's. I don't give them steaks. I don't give them bacon. I don't give them eggs. We give them organic alfalfa. That's it. That's all they eat all day, organic alfalfa. And they don't need a doctor. They don't have stomach pains. They don't have angina. They don't have this. They don't complain. And they're happy. Camels the same way. Elephants the same way. Dinosaurs were the same way. These big animals, why do they eat alfalfa? What's in alfalfa so special? You know what time in my farm when we were building the racetrack for my farm so we can train the horses, we were digging in the ground. There was a hill like this, planted organic alfalfa. We're digging next year to make the track, and we came to alfalfa plant in the top, and the root down was 6 feet deep, and the plant was only 2 feet high, and the root was like a dandelion. He was like, oh, dandelion, don't get rid of dandelion, eat them. If you find them, eat them, don't kill them, okay? Do you know the dandelion is good for you, right, or no? No. You don't know that? No. DTX is made from dandelion. Celmerian is Cecil, it's from the same family. You know, one time I have a home in California, and they like nice lawn in the backyard, and the kids said, oh, look at all the dandelion growing like this. It looks crazy. And then I said, okay, I'll go pick it up. And I started picking up. In the middle, I started thinking, why am I picking the dandelion? Why am I doing that? Why I just can cut it and eat it? So I started cutting it and eating it, because that's what I did in the village in Egypt. We eat lots of dandelions. I was cutting and eating, and then the neighbor was looking at me. I said, oh my God, this guy thinks I'm crazy. So I started hiding the dandelion under my arm. I swear my God, I did. And we have a table with an umbrella. I put my back to him. I put it in front of me. I finished it. But I had cramps, but I felt fine. Okay. Alfalfa. The active ingredient we don't know exactly, but it has 8 essential amino acids. It has lots of calcium, magnesium, and potassium and zinc. It has lots of beta carotene, vitamin E, vitamin K, chlorophyll. It's one of the best thing for bad breath in the stomach. It's a powerful antacid. 10 alfalfa will neutralize lots of the acid in the stomach, like with protein. Okay. Alfalfa also, you didn't know that. Alfalfa also have isoflavone like soy protein. Alfalfa have sterol that shrink the prostate. So if you have larger prostate and you take tuna alfalfa, your prostate will come down better than saw palmetto even. Saw palmetto is good, but alfalfa even is better. It has also phytoestrogen. We don't want to tell the doctors that they're going to tell us not to give it to women with breast cancer. No, forget about this one. Okay, it has saponin glycosides. It has fibers. It lowers the LDL. It has also antiplatelets. So alfalfa has vitamin K, makes blood clots. It also has antiplatelets like coumadin. So you know, some people said if you and coumadin don't take alfalfa. That's not true. Alfalfa doesn't make you clot more. How many animals, horses, we see blood clots in their legs? You know, we don't see that. It's useful. Right here I made a summary for you. It has the 8 amino acid. It has the calcium, magnesium, potassium, zinc, sulfur. It has MSM in it. It has antioxidant. It has isoflavones. It has phytoestrogen, glycosides, coumadin. It's also anti-pain. It's also for arthritis is good. It's a PG2 inhibitor, prostaglandin 2 inhibitor. It's used for digestive problem, for kidney problem, for diuretic, for arthritis, for hormone problems. And that is the end of the lecture tonight. So I'm going to thank you so much. And thank you. I'm going to give you my phone number right here. So I wrote it since last time. The cellular number is 847-571-3914. And if you call me, leave a message, and then I get back to you in the evening. And the other number is 847-356-9009. It's the office. Now we're going to be taking some questions. from the front to the back. The one who came first, ask first. The one who came last, ask last. So, no, I'm just kidding. So I take the last one. So you, yeah. Okay, yes.
How much alfalfa should we take a day?
How much alfalfa? I take 10 alfalfa a day. But I know some people take 30 and 40. There is no limit except your budget and your stomach. But it is food in tablets. The problem with vitamins, many people think that pills, they're drugs. It's food in tablet. Anybody say that to you, tell them, how big is a Big Mac? This big. Vitamins is not that big. So you can, people say numbers. I would say, whatever make you comfortable. Some people might make tea out of it. I have not done that yet. But I think some of you might have. You can actually grind it in powder and put it with green tea or put it with honey or put it, you know, you make, or put it in the salad. You know, if you don't want to take so many pills, you can powder it. You have a question?
Yeah, I was wondering about the autoimmune diseases. I thought, is there still kind of caution to use this with autoimmune diseases?
No, some people say autoimmune disease, you cannot use that. No, because the function of this has nothing to do with autoimmune. Autoimmune diseases, you're making the wrong antibodies against yourself. NutriFeron has nothing to do with that. You're going to make it regardless. You're going to make it regardless. So in a case like that, it is the lack of omega-3 that give you a problem with autoimmune, not NutriFeron. NutriFeron, still I will give it to my autoimmune patients. But you have to, when you have an autoimmune problem, you have to be under supervision of a physician who is in holistic medicine, which I think in the near future, you will probably have somebody in Milwaukee area for our board, and we have a catalog. We will let everybody know the location of those doctors who are going to be board certified in holistic medicine. So we have people in gynecology, we have people in neurology, we have people in every specialty. Every specialty medicine, we have holistic medicine doctors in it. And so we have no problem, even oncology. I referred a patient to oncologist, and no, the patient came to me and told me the oncologist asking what type of vitamins you take, you know, what kind. Then they showed him Shaklee vitamins. I said, what's the name of that doctor? They gave him my name. He said, yeah, I saw him in Texas. He was with me. So the guy practicing in Illinois next to me, I didn't even know. You know, so there's a lots of new doctors gonna practice proper medicine. But we have lots of, the most dangerous person in the world is a person with half knowledge. You know, half knowledge is called a dangerous person. Because some people claim they know and they don't know. And they make a statement and they make it bad for us in nutrition. NutriFeron has nothing to do with anything with autoimmune at all. Yes?
What about for younger children, particularly like that were premature babies and that had a lot of that nebulizers with that prednisone and all that stuff? Can you give them NutriFeron immunity on eye?
Can we give NutriFeron to the kids that just been born? Let's look at...
Not born. They're like about 2 years old.
2 years old? Okay, yeah. 2 years old. Let's look at that. Here is the NutriFeron. Should we give them pumpkin seeds? Well, Halloween is here, so they're going to eat pumpkin seeds, okay? And you're going to cook it for them too. They're going to eat plantain seeds. They're not going to hurt them. Are they going to have safflower seeds? You know, I think we are scared. We try to say, okay, this for this age, NutriFeron will not hurt anybody at any age. But it might be better to have the child who's young have the C and the E and the B and the multivitamin protein first, and omega-3 before you worry about NutriFeron. Okay. NutriFeron is in the bottom list. And up to flora and things like that. But I think we should really think that omega is in the top, Vitaly is in the top, soy protein complex is in the top, E and C is in the top, B complex in the top. Before we worry about NutriFeron, it's in the bottom, let's think about the top. Okay, just one, yes?
How many alfalfa should a person take to address the prostate?
I have not tried. I'm going to repeat the question. How many alfalfa somebody should take to shrink a prostate? I have not done any experiment on that yet, but I will believe that's probably about 20 a day. Okay, we're going to go in the middle right here so people don't throw a stone at us. Okay, we're in the back then. Okay, yes, ma'am.
I didn't hear what you said about autoimmune disease.
The question was, should we prevent people with autoimmune from taking NutriFeron? Or should we be careful? Are you following me? Yeah. And I put the slide saying it has the pumpkin seed, has all that. I don't see, as a chemist, as an agronomist, I don't see the problem.
So it's okay.
Of course it is okay. It is okay. But what I said to her, let us worry about the protein and the other basics first before worry about NutriFeron. We the oldest need that, not them. Okay, any question in the back? None? Okay, yes ma'am. Okay, just a minute. Okay, you first and then you second.
With chronic fatigue syndrome, the interferon will help that. Should we take more than the recommended amount?
With chronic fatigue syndrome, patient take more NutriFeron. Yeah, if you do a blood test, you have identified the cause, and you have eliminated the differential diagnosis. It is not AIDS, it's not HIV, it is not hepatitis, it is not diabetes. You eliminated that, yeah, you can take extra NutriFeron.
So
But
take maybe double?
You can take 6, but the problem is when you have symptoms, you must know what is coming from.
You have to have a diagnosis.
Exactly. And if the doctor did not give you the proper diagnosis, then you can call me and I can tell you what to tell him, what test he should do for you. Okay? Yes, ma'am.
How harmful is it to take all these supplements on an empty stomach? By the time I chase it down with soy protein, I'm already full.
Oh, did you hear that question? We all have the same problem. She said by the time she ate all the supplements with soy protein, she's already full. Well, you know what? I think the best thing to do with supplements is to divide it in a small doses with meal through the day, number 1. Number 2, take it after meal, not before meal. So if you know you're full, don't take any more. Are you following me or no? You still need salad, you need fruits, you need vegetables. So make the supplement a lot. Don't take it in an empty stomach. Take it with food then. Any other questions? Yes, sir.
Is NutriFeron the best protection at the moment in anticipation of this
Bird flu?
Bird flu?
Absolutely. Absolutely. If you do everything else we talked about, that's exactly what I would do. And then you have to understand, everybody here, when you get sick with flu and you have fever, that is a good sign. That is a good sign you're having fever, you're having aches. Your body is trying to fight back. You don't want to suppress the fever with aspirin and Tylenol. You don't want to suppress the pain with ibuprofens. You can take some Benadryl if you're uncomfortable, antihistamine, so you can go to sleep. But you have to be working with your body. I had a patient with lupus, Amish or Mennonite, I'm not sure which one, came to me, and I gave her the treatments and everything, and she had a fever next day for 104. What should we do? How much Tylenol we can give her? I said, none. Just give her Benadryl and call me tonight. They took the vitamins. Tonight, the fever is still 104. I said, call me in the morning. In the morning, it's still a fever 104. I said, call me at night. The fever down to 103. Next day 102, next day 101, now to 99. How does she feel? She feels wonderful. We haven't given any drugs. Are you following me or no? So fever is a good reaction to the body. I used to remember my mom when I left the village, going to the city. In the village we have no doctors. We have dust and mud, adobes, and no electricity and no asphalt, no gasoline, no kerosene, no nothing. Just natural stuff. So she said, whenever you get sick, induce fever for yourself. I said, how should I do that, Mom? She said, well, if you have a cold, just get some olive oil, rub it in your chest, and get a newspaper, put it on regular paper, not just regular paper, and put a plastic bag around your neck and your waist. Be hot, and when you start sweating all over, just go to sleep, and when you wake up, you'll be fine. And you know what? Every time I had a cold, I did the same thing when I was in Cairo University, and it worked. Apparently, when you heat the body, it helps. But when you go from hot to cold, hot to cold, hot to cold, of course you're going to have problems. You got to cover your mouth, you got to cover your face in the winter, you got to stay moist and warm, not just go ahead and play hockey and all of that, and you're going to play in the snow, cover your nostril really well and have the kids cover themselves. Because cold air is not healthy for the lung, it's not healthy for the body. It's not. It paralyzes the lung inside. Sometimes it freezes it. Thank you very much, and you have a good night.
I have to apologize. I was asked before the lecture to make an announcement, and I failed to do it, so I'm going to make it now.